So this is part 5 video of the AV fistula. So far we have seen till the pre-operative preparation of AV fistula. In this video we will see regarding few important points related to the day of surgery and the immediate post-operative care. My voice is not good because of cold. I will try to finish this in 5 to 6 minutes video, a short video. So the patient have been decided for AV fistula and AV fistula creation has been pre-op assessment. All assessment have been done and subsequently the day of surgery came. And in the day of surgery, it can be done under local anesthesia or the regional anesthesia. As I discussed before, it can be on the distal side, which is the radiocephalic fistula most commonly, and the brachiocephalic fistula. Radiocephalic fistula most commonly being done under local anesthesia. A 5 to 10 ml of lignocaine under local infiltration above the artery and the vein. Surgery depends on the patient vessel anatomy and the ease of surgery lasts from an average from 45 minutes to 2 hours. Mostly if the veins are good, they can finish skin to skin within maximum 1 hour to 1.5 hour for radiocephalic. Brachiocephalic can be done under local anesthesia also, but many prefer axillary block. Depends on the preference of the surgeon or the nephrologist or whoever is doing that. Brachiobasilic fistula transposition usually require regional anesthesia. Why I am telling this? Because mostly patient or the attender will be having this question whenever we counsel regarding the need for AV fistula. And one more point, in the pre-op preparation, you have to tell the patient to do exercise of the forearm or the smiley ball exercise. He can use the sponge ball or lift a very low kg weight like 1 kg weight or hand grip exercise he have to do so that the veins will become prominent. This have to be done till the day of surgery, not immediately after the surgery. After 2 to 3 days of the surgery, the exercise can be resumed, depends on the vascular integrity. Suppose if the surgeon feel the patient is not at risk of rupture, he can tell the patient or the attendant to continue the handball exercise. Depends of how many days after the fistula creation. Ideally, 4 to 5 days. If the vessel integrity is good, even after third day or fourth day, you can ask them to start with minimal exercise. But in the sorry, in the pre-op period, if they do exercise, the chances of maturation is very good because the vein the vessels get prominent. So that is the importance of the exercise you have to counsel the patient for. And currently cosmetic suturing is also available. What is that? Subcuticular suture. Once the surgery is done, in the ideal situation, the suture marks will be visible after the suture removal. Nowadays subcuticular suture technique are available, so cosmetically also it might not appear outside for the patient, those who are concerned with the cosmetic uh, prospect in the forearm. So these suturing is also available. These also can be told to the patient. So immediately post-op, what are the day of surgery? What are the things surgery is done? In the post-op period, you have to counsel the patient to keep the arm elevated so that the occurrence of edema will be less. Very tight dressing to be avoided. This is very important because very tight dressing, if the nursing staff is new or the resident who are handling the fistula is new, they might apply a tight dressing to avoid the bleeding. But what will it do is it decreases the blood flow and cause the failure of the fistula. Preferentially, the circumferential dressing have to be avoided. So a broad spectrum antibiotic with the gram positive coverage have to be given for 5 days. Ideally, the BP range to be on the higher side. You can skip 1 or 2 BP medication so that the BP to be maintained on the higher side, not above 160. You have to bring it down towards 160 and below will be good, because a good blood pressure is required to keep the perfusion from the newly created the connection from the artery to the vein. The fistula will have a very good flow if the BP is on the higher side. One of the important causes of fistula failure is hypotension. So that part, to avoid that in the immediate post-op period, the BP have to be maintained. So regarding the exercise, as I told you, after 5 to 6 days or ideally 4 days, 5 days gap, you can ask the patient to start exercising. So these are all the important post-op care you have to tell the patient. Another most important question: when to remove the suture? Ideally after 14 days. The dressing have to be changed daily. Regarding the question regarding dressing, the dressing have to be changed daily. Look for any local wound infection. After third or fourth day, if the suture site is healthy, no need for external external coverage of the suture site. Just you can keep it open after the fourth or fifth day. The suture have to be removed on an average after 14 days, and fistula needs minimum 4 to 6 weeks for it to mature, because the vessel needs remodeling. Immediately after fistula creation, fistula can't be cannulated. Most of the medicos know. From the patient attender point of view, they will be thinking as soon as the fistula is made, they can use it from day one after creation. No, it can't be used. You have to wait for minimum a period of 6 weeks. Don't prematurely cannulate. Inform your nursing staff. Otherwise, there is a chance of failure of the fistula, permanent damage to the fistula. So these are all regarding the important pre-op plus immediate post-op of fistula care. And in the next video, we will see regarding what are the criteria of maturation and what is the most famous rule of 6 in AV fistula. This we will see in next video within 2 or 3 days. I hope the video is helpful. Bye bye.